Welcome back to the Mental Path Podcast. I'm Dr. Gretchen Guevara, psychiatrist, psychotherapist, and your go-to for science-backed, real-life strategies to help you reset your brain, rethink your habits, and reclaim your energy. My style blends medical science, psychology, and personal development strategies to build mental strength. If you're new here, hello, I am so glad you're tuning in. If you've been following along, you'll remember that in our last episodes, we talked about mental chatter and worst-case scenario spirals that hijack your calm and leave you stuck in anxious overdrive. Well, today, we're continuing that conversation by touching on something that often starts with those spirals, but goes way deeper. We're talking about OCD or Obsessive Compulsive Disorder. And spoiler alert, it's not just about liking things clean or organized. There are so many misconceptions out there about OCD. Let's start here. OCD is not a personality quirk. It's not just, I like my desk super neat and clutter-free, or I double-check my car doors. There's a condition called Obsessive Compulsive Personality Disorder that is separate, and we can talk about that in a different episode. Here's what I wish everyone understood about OCD. It's when a thought pops into your head and your brain just won't let it go. Let's say a fear shows up. If I don't check the door again, something bad will happen. Now, your brain starts looping, obsessing, hyper-focusing. It imagines worst-case scenarios, ramps up anxiety, and refuses to drop the thought. So what do? You perform a ritual. Maybe it's washing your hands 100 times, rechecking the same article online over and over, or asking a friend for reassurance as many times as you can. That ritual, it works in the moment. It calms the anxiety. And because it brings relief, your brain releases dopamine, a feel-good neurochemical. And now your brain starts to learn this loop. Anxiety equals do the thing equals feel better. So it keeps doing it. And the loop becomes a habit. And the habit becomes a pattern. And the pattern becomes so hard to break. So what's really going on in the brain? OCD isn't just a mindset problem. It's a neurobiological condition involving brain circuits related to decision-making and behavioral control. These areas become overactive. The neurotransmitter serotonin plays a big role here. Normally, serotonin helps you feel calm, present, and grounded in reality. It helps you trust your instincts and assess actual danger versus imagined danger. But in OCD, when serotonin is dysregulated, your brain has a harder time letting go of the fear, even when the evidence says you're safe. This is why OCD doesn't go away with logic alone. It's not about knowing the thought is irrational. It's about teaching your brain to stop reacting like it's an emergency every single time. So how do we treat OCD? You know, I'm always about retraining the brain, and when it comes to OCD, that's exactly the goal. We're teaching your brain, yes, this thought feels scary, but I'm still safe even if I don't act on my compulsions. This process can be uncomfortable at first because you're learning to sit in the discomfort without reaching for the old compulsion. So how do we do that? The standard therapy for OCD is cognitive behavioral therapy, especially a version called exposure and response prevention therapy, or ERP. Let me break this down in real terms. ERP means you identify the trigger, you expose yourself to it gently, gradually, and you resist the urge to do the compulsion. I like to think of it like climbing a ladder. At the top is your goal, no more compulsions, but we don't leap. We build the steps to reach the top. Maybe the first step is just thinking about the compulsion. You could reduce the time spent doing it. Then you reduce how often. You're slowly telling your brain, I know you're uncomfortable, but I can handle it. And over time, your brain starts to believe you. Then there is the other cognitive work, catching the thoughts in the act. Now, one of the tools I teach in this podcast over and over is how to notice early cues before you even realize you're obsessing. It's like before you think about what to do, you have to catch the cues that your body is giving you so that you can do the thing that you're supposed to do and practice. Here's a simple version of my body, mind, environment check-in you can use right now. First, the body. Is your heart racing? Are your hands shaky? Do you feel physically on edge? Then your mind. What's the loop your brain's stuck on? Can you name the story it's telling you? Then your environment. What's around you right now that might be contributing to the spiral? Once you notice the thought, you challenge it. Ask, is this thought true or fear? Is it based on now or the past? What's the evidence that it's not true? What's a more balanced, realistic thought I can try? Here's an example. The obsession could be, if I don't wash my hands 100 times right now, I'll get sick. The reframe after asking the challenging questions could be, okay, I've washed them once thoroughly. That's enough. I'm clean. I'm safe. This is CBT in very simple terms in action. And no, it's not easy, but with practice, it's very possible. Now, some people also benefit from medication, especially SSRIs or selective serotonin reuptake inhibitors. These help support the serotonin system in the brain, so it's easier to regulate thoughts and reduce anxiety. They do not erase the work, but they support the work. Think of medications as scaffolding while you build new thought patterns. In my practice, I've seen a spectrum of symptoms from mild OCD to severe cases where there's psychosis. Psychosis is when you have strong thoughts that are out of touch from reality. This is harder to treat and usually is relieved with a short course of antipsychotic medications. In all cases, mild or severe, consistent use of thought-challenging strategies has been most helpful. The most successful cases I've seen are those who are committed to filling out worksheets to guide them through the thought reframing strategy. It took a long time, but with a combination of healthy lifestyle, thought strategies, and for most, using medications like SSRIs, symptoms can improve. Here are some takeaways I want you to walk away with. OCD is a real treatable condition. You're not too much and you're not broken. You're a human with a brain doing what it thinks is protective, just in a way that needs calibrating. With the right tools like CBT, ERP, sometimes meds, and with the support that sees the whole you, not just your symptoms, you can build a brain that doesn't live in fear. You are more than your compulsions. Your thoughts do not define you, and healing is possible. Next time you feel caught in an OCD loop, try the body-mind environment check-in to catch yourself. Just notice. That's the first step towards changing the pattern. And if this episode gave you a new way to think about OCD, please share it with someone who might need this clarity too. Next week, we're diving into something that keeps so many of us stuck in mental loops: regret. You know, those what if and I should have thoughts that can hijack your peace faster than you can say, overthinking, stop. I'll be sharing how I handle regrets in my own life and the strategies that actually work to help you move forward instead of staying stuck in the past. You won't want to miss that one. Stay grounded, stay curious, and I'll see you next week.